physician assistant is a very integral part of a medical team. We can treat and diagnose, we can prescribe medications, and we can perform a variety of procedures. My name is Aneesa, and this is a day in the life of a physician assistant. A physician assistant treats patients under supervision of a physician. We have flexibility when it comes to how we work, where we work, even the specialty that we work in. I work at Kind Body, a fertility clinic, and I help patients get pregnant. Everything you see here is a very real representation of what I do on a day-to-day. I'll be seeing a new patient consultation, a saline sonogram procedure, a follow-up visit, and then really exciting, we have a couple who is graduating at their OB exit visit, which is when they graduate once they're pregnant, and we have something fun in store for them, so come tag along. I'm getting ready to walk into a new patient consultation. Good morning.
Good morning.
This is a couple who's been trying to have a baby for about a year. So I'm just gonna get to know them a little and go over some treatment options. Some people confuse us with nurse practitioners, but the main difference is in our training. Physician assistants are trained on a model similar to medical school, except it is much more condensed as compared to a doctor's training.
So in terms of testing, what is that process like?
We want to see how things are looking for both of you guys. And if there is anything indicated on that testing, we can certainly address it. Physician assistants can work in so many different settings: outpatient clinics, hospitals, operating rooms, and even in home health. There's just a variety of different specialties and fields that physician assistants can be part of. I'm about to go do a saline sonogram. I'm gonna go grab the sonographer and we're gonna get started. It looks like a pretty straightforward entrance into her uterus. I'm gonna use a catheter to put into the uterus. All right, okay. Some skills you want to have in this career are clear communication, attention to detail, adapting to change, and emotional intelligence, which is very, very crucial. When we're dealing with things of a sensitive nature in medicine, diagnoses, patients are not always comfortable. A little pressure. You doing okay so far? Mm-hmm. Sometimes it's an art, talking to people and how you interact with them. Okay, then I'm gonna start to put a little fluid inside. You might feel a little cramping. Looking good so far. Got make the coffee to fuel me up, and gonna finish up clinic this afternoon to see some more patients, so come on. Hi Claire, how are you doing? You recovering okay from the surgery?
Yeah, anxious for the next steps.
Well, your egg retrieval went great. What the results tell me is that we have a very good embryo available for transfer. This all means we're closer to getting you pregnant. We're so excited for you. I know you guys have had such a journey. It takes an emotional toll just because of the gravity of what we're doing. There's a lot of happy tears, but there's also a lot of sad tears and a lot of loss. What helps me get through it is knowing that there is a light at the end of the tunnel. Hi guys, how are you?
How are you?
Congratulations.
Thank
We're
you.
so excited. Baby's looking great. If you want to become a physician assistant, you'll want to get your bachelor's degree, get some shadowing experience, apply to PA school, get your master's of physician assistant studies, and then apply for your dream job. We have a little gift for you, just our way of saying congrats, and I know everyone here is super excited for you guys. We need as many people who care about other people in this world. And I think being a physician assistant is a really great career to be able to do that.
1, 2, 3, baby.
Baby.
Thanks for watching. Be sure to subscribe to our channel and search Indeed for more A Day in the Life videos. We'll see you next time. Bye. That's better. Okay, try not to talk. Is that like my natural English?
Yeah, I know. I'm like, it's like, how do I?